Hi guys, it's Dan at Shore Physio, and in this video we're going to be going through the next of our activation techniques for our upper body corrective exercise series. So we've done the chin tuck exercise, we've done the external rotator one, the no monies. Now we're going to be doing the Serratus anterior. So this is going to be a wall scaption exercise. I won't lie to you, this is quite a strict exercise. There's quite a few things we have to do to get this, to make this effective. It's not the most pleasant exercise as well. It's pretty tough, especially if you've never done it before, or if you are lacking quite a bit of shoulder mobility and have some weakness there. It's a tough one. It is a tough one, but it's a really good one. A really good one for, again, bringing back that strength, keeping hold of that new range of motion that we've got, and really restoring good shoulder and thoracic spine kinematics. A really good one to do. And that whole scapulothoracic connection and interaction we get back with doing this exercise. It's a really, really good one to do. But like I said, it is tough and it is quite strict. So I'm going to take a bit of time with this one. Just bear with me. Don't worry if you don't get it right the first time. You can always come back to the video, or you can always message me, email me, and we can go through it. But a really good one to do. So with this one, what you want to do is bring the feet away from the wall a bit. Get your spine in just in that neutral position, so we're not completely flat, we're not arched, we're not looking out this way. Is just get nice and get the shoulders down and back. Sometimes if you need to, I'll show you actually from the side here. I do put something behind someone's head, so you can do it, so you've got something to place the head against. I'll show you the side view for that bit. But for now, just shoulders down and back. So try and pinch the shoulder blades into the wall. Tuck your bum under, so just tuck your pelvis, but your bum under just slightly, so you've got a nice neutral pelvis there. The back is just, you've got a bit of space there, so it's got a nice natural normal curve. Shoulders are down and back, so we're not doing this. Shoulders are down and back. What we're going to do is going to turn the thumbs out about 45 degrees, keep the shoulders down. And we're going to start to bring those up while keeping the shoulder blades down and pinched into the wall. Bring those up about a 45-degree angle, in almost like a bit of a Y sort of shape, sort of like a Y position. We're going to go up as high as we can. We're going to try and get the thumbs to tap the wall behind us without any compensation. So we don't want to be doing any of this. Okay, we don't want to be doing any of this or any of this. Or we don't want to be bending the elbows. We don't want to be doing any of this sort of motion. It's got to be nice and strict. So shoulders down, squeeze back into the wall, pelvis tucked under, chin tucked, arms are coming up. We're going to tuck the thumbs against the wall. And then that's going to be one rep. I'm going to come back up again. Thumbs to the wall, back down again. So that's what we're looking for. If we can get to the thumbs to the wall, then we can tuck under and we can go a little bit further, go to there, and then come back down again. So that'll be the next part of it. I'm going to show you guys from the side, because like I said, it's nice to see from the side, because you can't always quite see from that position. So again, we don't want to be here. We don't want to be completely flat, we just want to be nice, natural, normal curve right there. Okay. Shoulders are depressed and pinch back into the wall. And I usually have my head against the wall as well. Now, if that is a bit of a problem, sometimes if we are what we call quite kyphotic and rounding, we have that forward head position. What I do sometimes is put that pad just behind on the wall, and then that way, the patient or client can then tuck the chin and push their head into the wall, so we're in that position. So sometimes that does help people a lot. So we could do that, or use a couple of towels as well. That could work as well. But going back to it, shoulders down and back, nice and normal natural curve. Shoulders pinch into the wall, and then we're going to start to come up. Thumbs against the wall. Again, we're not doing any of this. Shoulders are staying down and back, coming back up to there and back down. That's what we're doing. If you can't quite get there, that's fine. So if you can't get the thumbs to the wall, which there's going to be quite a few of you who can't do that yet, because we're still getting that range of motion back, and that's quite normal. Don't worry, it's not a problem. Use the range of motion you have. Don't try and force range of motion you don't have, because if we do that, then we're just compensating again. So use what you've got, okay, and that's totally fine. If you get to here, it's fine. If you get to there, it's absolutely fine. Use what you've got. Make sure the range of motion that you are using is good quality, and we're not trying to cheat, we're not trying to use range that we don't have. Because if we do that, nothing's going to change. So we've got to take it step by step. So even if you get to here, even if it's like, as you get to there, you notice that the shoulders are starting to creep up and you can't go anymore. So if I got to say there and I just want to creep up, that's it. I'm going to hold it there for 4 seconds, really fight on keeping my shoulder blades down and come back up again. And again, coming up, I notice I just want to creep up, or I'm starting to arch from the wall or move my head off, anything like that I start to notice. Hold that position, really resist it, fight against those compensations, come back down. So just use the range of motion you have. So there you guys go. That's the serratus anterior, so that's the muscle that we're working. And what that muscle does is, we said about how the pec minor, the elevated scapula in those release videos, causes those shoulder blades to kind of stay downwardly rotated. Again, going back to that good old corkscrew analogy, when you push the head of the corkscrew down, the arms come up and you've got those two rotors, those two pivots, which is just like our arms and our shoulder blades. Those two pivots are basically our shoulder blades. What this serratus anterior does is it rotates them up, which is what we've lost because they get stuck downwards. The muscles that rotate them up, the serratus and the mid and lower trapezius, have all got weak, so we really want to get those strong. So when we do reach our arms up overhead, then those scapulas are down and back, they can rotate freely, give us that full range of motion, and also help us stabilise and maintain that position and not getting too weak where we have to fall down. So if we're doing something where we have to keep our arms up a lot, or we're repetitively bringing our arms up overhead, something like a basketball player or even like a volleyball player, or even sometimes like a tennis player, we really want those muscles to be nice and strong and also have the endurance there to keep doing it repeatedly. So really good, not just for general function, but also for sport as well. We want to be able to have those shoulder blades that can rotate upwards and help maintain that upward position and be strong in that position as well. So if we are throwing from here, we want to have good kinematics, good techniques. We don't want to have any compensation. We want to be able to produce as much force as we can. Where we're going to get that is if we get those muscles really strong. So there you guys go. Any questions on this one, let me know. I know it's a bit of a strict one. It is really tough, but it's a really, really good one to do. Definitely a good one to start putting in the program. And remember, use the range of motion that you have, okay? We can work our way up. So there you guys go. Any problems, any questions, let me know. Take care, and I'll see you next time.